Anal fistula or fistula in ano is an abnormal communication or a tunnel between the anal canal. This is the anal canal and the skin around the anus. This is the skin around the anus. So, anal fistula is an abnormal communication or tunnel between the anal gland and the skin around the anus. Now the next obvious question which everyone asks is, how does anal fistula develops? Well, to understand this, you must understand there are anal glands located in this region. The infection of the anal gland leads to the anorectal abscess formation. This is the abscess. The infection of the anal gland leads to this abscess formation, and abscess has a thumb rule: until it is drained, the volume of the abscess keeps on increasing. So, during this stage, patient complains of pain in the buttocks. It can be either one-sided or both sides. Pain on sitting, lower back pain, pain or discomfort during the motions, or fever. The severity of the symptoms keeps on increasing until and unless it is drained. So, how does this abscess drain? Well, there are two ways in which abscess can be drained. One is spontaneously or automatically. The skin around the anus, it ruptures, and the abscess, the pus which is present over here, it comes out. The second way is surgically. Under anesthesia, we give an incision at the swelling, over the swelling, and we drain the abscess. Now, what happens post the drainage of this abscess? See, either this abscess cavity which is left behind after drainage of this abscess, it can heal on its own completely, or it can present as a persistent path or a tunnel between the anal canal and the skin around this anus. So, this is how an anal fistula develops following an abscess formation. Now, you may ask, like, how many percentage of the patient develops an anal fistula post an abscess formation? The ratio is around 40%. Around 40% of the patients who develop an anorectal abscess develops an anal fistula.